Welcome back to Sports Medicine on Tap. My name is Brandon O'Lyon. I'm at Neck of the Woods Brewing Company with my good friend Dr. Frey. Dr. Frey, how you doing this evening?
Spectacular.
We have a return guest. Doc, how you doing?
I'm doing good.
Yeah.
Good. Thanks for having me back.
I know, like, it's kind of crazy. We've been talking pre-show a little bit. Having you back on, Dr. J, like, man, it's only been 8 episodes for us.
Yeah.
But last time we had you on was back in December when we were talking to Alex Singleton and testicular cancer and all those other things.
Right.
So tonight, you kind of prompted our discussion for the night, and it was like reversal.
We're
Well, we
going
did
back
hint
to
that-
urology.
Yeah.
It's not.
Yeah.
It's not easy.
Yeah. We hinted about
We
it.
hinted.
Right,
The last-
right,
We
right.
said, stay tuned.
Yeah.
It's coming.
And
so.
I had forgotten, and I'm glad we got the reminder.
Yeah.
Because now everybody else gets the reminder as well.
Yeah.
With going into tonight, before we go ahead and go too deep in tonight's episode, just want to give a reminder to all our folks out there that Sourfest is happening this weekend, May 16th, here at Neck of the Woods on Saturday from 12 to 8 p.m. So make sure if you're listening to this, hopefully you're getting it on the release day on Friday. It is tomorrow. That you can come out to Pittman, New Jersey at Total Turf and have a bunch of different sours and have all these great beers that we always talk about here on our show at Neck of the Woods as well.
Heck yeah, baby.
Now, to go into tonight's topic, Dr. Krishnan reached out to Dr. Frey and reminded him that May is Bladder Cancer Awareness Month.
Yeah.
And it's a great topic and definitely a little bit off the cuff of what we usually do.
Right.
But that's kind of why it's so important, I think, in my opinion, because it's a little different, but also very relevant to the things that we can kind of see.
Right.
And we do have a list of folks who have unfortunately dealt with bladder cancer and are related to the sports world.
And probably a little less likely to be the high school, college athletes,
Right.
maybe some of your professional athletes, and
Yeah.
then certainly some of the coaches
Yes.
at risk in this particular issue.
Yeah. So, I mean, every cancer has its own month.
Right.
So, and that includes bladder cancer. And so May is Bladder Cancer Awareness Month. So
Right.
it's nice to be able to talk about it.
Right.
And we have quite a high incidence of bladder cancer now. Up to 85,000 people per year are
Right.
diagnosed with it in the United States. So even though we don't talk about it a lot, we don't hear about it a lot, it is important. And tonight, I think we can talk about things to watch out for, even if
Right.
it's not just for yourself, maybe
Yeah.
your loved ones, or your folks or whatever,
Yeah.
And it's nice to talk about it.
Yeah.
Yeah.
For sure. For
And
sure.
I think the last time you were on, we hinted at this, like you mentioned, and I think the notable person, if you will, to kind of start the list of people who've been affected by this is Deion Sanders.
Right.
Yeah.
Right. And I mean, Deion Sanders is prime time still. He's very
Prime
relevant in the
time.
world of sports, especially being a head coach now. And his health has also been very much in the spotlight for various things. He's had issues with vascular issues,
Yeah.
which is, I think, kind of what tied into his diagnosis of bladder cancer from doing his checkups with all the vascular stuff that he had going on. And then he underwent treatment and other things like that. That's what kind of started this whole episode. We mentioned him last time,
Yeah.
and then we have some other folks that we'll get into.
So yeah, first, how did some of those things, those early things that he had, some of the vascular issues, lost 2 toes, right? Like amputated.
He had amputations,
Yeah.
2
and
toes.
and I think there was a lot of diabetes and blah 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 and this and that, and then turns out maybe that wasn't really the underlying root cause. How were those things connected?
Yeah, so what happened was he was going through like routine medical checkups, and they found some kind of a blood clotting disorder. And
Right.
They didn't really have a reason for it, and he had multiple other, cardiovascular disease. He had diabetes, other things going on. But when they started diving into the blood clotting disorder, they realized that he has a mass in his bladder,
Right.
and so he immediately had surgery to remove that mass in the bladder. So anytime you have cancer, you can have changes in your body that can be weight loss, you can have blood clotting disorders, you can have blood in the urine, you can have a number of different things that are going on.
Right.
And sometimes you don't think, oh, that's related to this cancer, but our body is weird in so
Right.
many different ways, and the way it manifests symptoms, we don't know what they are. And
Right.
so modern medicine, we're able to do a number of different scans to find out what's actually going on with you. But you have to go to the doctor in order to get those scans, right? You can't just do it without a doctor, right?
And lots of times we'll chalk that stuff up to diabetes, and who knows, maybe that in this particular case, diabetes was a factor there. You start having issues with your toes. People get something called neuropathy in their feet, so they can't really feel real well, and then they lose some of the protective sensation and protective reflexes, and also their ability then to heal. What happens in kind of the classic story is somebody steps on a piece of glass or something, cuts their toe, cuts their foot. They don't know, they're not aware of it. Their ability to heal that injury goes way down with as a byproduct of the diabetes. It becomes infected, it gets out of control, and then they wind up with an amputation. But sometimes it could be different.
Yeah.
In this particular scenario, one of the other things that happens oftentimes with cancer, anytime somebody gets an unexpected blood clot, they usually go through a cancer workup as part of figuring out why, right? And because it puts you into what we call a hypercoagulable state. You tend to just clot more. And it sounds like maybe in this situation, people can get little clots and they break off and they land down near your toes, and then you're not getting the blood side to your toes, and then it necrosis. And your only option is, boom, take it off, right? And so maybe it wasn't necessarily a diabetic issue, but more of a vascular clotting issue.
Now, one thing good about his scenario was that it was caught early enough that he's essentially cured. So he came out and he said, and his doctors have said that he's completely cured.
Right.
And that's because he got it diagnosed so early. So I think the blood clotting disorder came about. He got that checked out right away.
Right.
And then one thing led to another. And I think we'll talk about how his path is going. I mean, that's what happened in the last episode. He had just had this bladder removed.
Right.
And that's what our sneak peek was in the last episode.
So what is it that, why does that mean it's in this particular situation? They take out his bladder. Why does it mean he's cured of this cancer?
Yeah. So he fortunately, was a type of cancer that was contained within the bladder. So it did not spread outside. So they had done a different set of scans to make sure that it wasn't outside of the bladder. And they removed his bladder. He chose to have that instead of chemo, instead of radiation. So he didn't have any chemotherapy or anything like that. He said, let me just take the bladder out. They made him a new bladder out of intestine. So this is amazing. Yeah, it's amazing. And we do that here. We do that at Virtua Health.
That's incredible.
So, so this is where we take the intestine and make it into a new bladder.
How? How does that work?
Yeah, so the new bladder is not exactly the same as your old bladder, the one you were born with, but it's pretty similar, right? So we design it to the capacity of what we think a normal bladder would be.
Can you do without a segment of your intestine?
Yeah, so we use a small intestine, and it's just wrapped together and made like a pouch or like a balloon.
Right.
And then it doesn't always empty all the way, but then you use your abdominal muscles. So we train you how to use your own muscles.
That was going to be my next question. How are you able to control when you go?
Yeah. So we actually have you meet with physical therapists.
Yeah.
Like Brandon, who help you, so you can use other parts of your body, like your abdominal muscles, your pelvic floor muscles, to drain this new bladder completely.
Do you still have the urge to urinate, to go? Like, do you know when your bladder's
you
full?
You don't always have the urge. So we do a lot what's called timed voiding. So you kind of set your timer for 3-4 hours, and then you wake up if it's the middle of the night or during the day, and then you go to the bathroom.
Yeah.
How, is this a newer procedure?
No, we've been doing it for probably 35, 40 years at least. Yeah, so we've been doing it. Now we do it robotic or laparoscopic, so we do it with small holes.
Right.
But
even crazy.
Before we were doing it with like a big incision,
Is it a one-stage procedure? Take out the bladder.
Yep, we do it all
backfill
at
with
once.
with the little intestine balloon.
Yeah, we do it all at once. Yeah.
Wow.
So this might be getting a little bit in the weeds here, but right. Your intestine is part of one tract and one system, and it's not a very clean system.
Right.
urine is sterile.
Yeah.
Right?
So we have.
Isn't that a problem?
No, we clean it all out in advance, and
Yeah.
then we have certain medications that you go on
Right.
that keep everything healthy and clean. So
And
the
there's not like a
intestines-
take it out and scrub it kind of process?
Yeah, we could do that. We could essentially do that. We could do that, but your own urine cleans it out, right? So
Right.
our body's amazing, right? It
Right.
adapts. So
Yeah.
eventually, the lining of the intestine that becomes your bladder
Yeah.
acts like a bladder, feels like it's a bladder because it's in that urinary environment. Yeah,
That's
the human body is amazing.
That's incredible.
believable. It is
Yeah.
unbelievable.
Yeah.
Honestly, like
Now, is that like the only option for in this regard of like rebuild? Is there's not like a synthetic bladder to be
No,
used?
so all those studies have failed. So
Okay.
we've tried cow. We've tried to take a bladder from a cow
Right.
and implant it to a human.
Yeah.
It failed. Yeah. And then human to human bladder transplant also has failed. Yeah.
I can barely get through an episode without having to go. I would have to elect camel, I
Well,
think.
the size of Dr. Frey's bladder will not be discussed in this episode.
It's bad news. It's bad news.
But there are a lot of different treatment options for bladder cancer. Bladder removal is not the only option. That's
Okay.
more for the more advanced stages of bladder cancer. But
Yeah.
we have 80% of the bladder cancer we diagnose is actually early stage, or just where we just treat it within the bladder itself. So you don't have to lose your bladder.
So you're just going to remove the
yeah,
cancer.
we remove the cancer, and then we do therapies that are just instilled within the bladder. Liquid chemo that goes in the bladder, and then you just urinate it out. So
Wow.
you don't have to lose your bladder.
Right. So this is like the removal of the bladder is like very much specific to the Deion Sanders case for what we're talking about, and obviously in certain cases it is the
Like John Daly, right?
Yeah.
We're going to talk. And
Right.
the PGA is going on now, right?
Right.
So,
Yeah.
and he's active. right?
Yeah.
And he's been playing. So he had a type that was just on the surface, and his bladder cancer was attributed to smoking. So. He typically would smoke a pack and a half a day,
If that, right.
Maybe more,
Maybe
and
more, correct.
And he said, it's not just the smoking. He said, I drank so much Diet Coke that it's like more than. It's unbelievable
Oh, yeah.
how much Diet
Right.
Coke he would drink.
the
Do you
amount of
think- is that
consumption
a
that
factor?
man.
It's like he owned the company.
Right.
So,
Right.
So no, I mean we don't know, right?
We
So
don't know.
part of me
Yeah.
is we've always thought maybe some of those synthetic things are
We worry,
are
yeah.
carcinogenic.
Yeah.
They could cause cancer. We don't really know. We can't really prove it. Who knows, right?
Yeah.
But the bottom line is cigarettes and Diet Coke caused him to have
Not a
bladder
great
cancer.
combination.
Not a great
Right.
combination.
Right.
And so he had bladder cancer just on the surface. He kept his bladder. He changed his life. He said he went down to 6 cigarettes per day,
Right.
which
Right.
is a huge win for
It
him.
is, right. Yeah, all
from a
things
pack
considered.
or more to 6. That's impressive, right?
Yeah. And I think he quit now. I believe he quit.
Is there? My gut is that there isn't, but I'll ask the question anyway. Is there any known connection between some of the performance enhancing drugs or that sort of anything along those lines and an increase in the possibility of or bladder cancer rates?
Yeah, so anytime you put something that doesn't belong in your body, there's a risk of developing anything, right?
Right.
So one of those things could be growths, and those growths could become cancer. So you have to be very careful with any of those kind of
Right.
enhancing substances.
Right.
Yes.
Right.
Yeah, because I
Absolutely.
would imagine, like, I know at least certain in the world of performance enhancing drugs and other things, like, I always advise athletes, like, be careful what you're taking because you could spend all this money just to have really expensive urine because you're just gonna like kind of just let
That's
it cycle
exactly
through
right.
cycle through your body. So I don't know if it's even worth it at that rate because you're gonna have like neon yellow pee or something or whatever
Right.
the line is, and then it's like you're not even absorbing whatever you think you're taking.
Well, that's a very good point. So the reason why you develop bladder cancer with smoking is because the byproducts from tobacco, nicotine, and tar all get urinated out. So they sit in your bladder, and the more and more that accumulate, the higher risk you have for cancer. So the same goes for any of these substances where a lot of it is being passed out through your urine.
Yeah.
Right.
Yeah.
I got to tell you, I would not have, I think everyone thinks lung cancer, right? Like that's the
Yeah.
one, that's where you go. But I mean, that's a valid point. You have all those carcinogens just hanging out and
Yeah.
a little balloon in your belly.
I mean, smoking is connected to like 35 cancers,
Right.
at
That's
least.
crazy. Yeah.
Which is crazy.
Yeah. Yeah.
Well, it's also, I think it's just interesting when you talk about smoking is how many different toxins or chemicals go in your body when you do that. And it goes right in your bloodstream, so then your blood has to like kind of filter it out somewhere. And I think that use of your bladder is like a filtration system that's kind of underrated or like not underutilized, but like underrated for how it like helps the whole system.
Underappreciated.
Yeah, underappreciated. That's the word I was looking for. Correct.
Right.
Yeah, so we talked about a little bit about John Daly as well, and then another. Well, to go on John Daly as well, I think when I looked it up a little bit back, at least last year, he mentioned that he was in 4 years of remission from his bladder cancer, so he's doing pretty well. Like we mentioned, he made those lifestyle changes as well that kind of help.
Yeah, and he didn't have the intestine bladder.
No, he didn't have to remove his bladder. It was an early stage cancer, right on the lining, caught early. He still gets checkups, so he gets all of his checkups done. He's on like a yearly program now, and he's going to be cancer-free. He'll be deemed cancer-free shortly,
So in Deion's case, where they removed the whole bladder and thus the cancer that was inside of it, is there a role for chemo after that, like just in case any of those cells escaped?
Yeah, he didn't need it. So we have particular cases where you do need chemotherapy afterwards.
Right.
That's identified right away. And then that's a good point too. So chemotherapy is not like what it used to be. It's not about your hair falling out and you throwing up all the time. No, the regimens that we have now, they're combined with immunotherapy. Yeah. And they're way better tolerated than what the stuff was before.
Right.
Yeah. So things have changed. Yeah. So there should be nobody fearing going to the doctor anymore right now. Because everything has advanced significantly from before.
And I think with that being said too, is that in our text when we kind of set this up of like notable people with this with bladder cancer, you mentioned former Vice President Hubert Humphrey had it, and he had it back in 1978, and I'm sure back then how it was treated was much different than it is now.
Very different, Right. So he did have his bladder removed, and then he did have chemo at that time. And then he actually lived after that, very much so. So, but things have gotten much better in terms of the way we do the surgery, the chemo that we give, the immunotherapy options that we have.
So, is there, with the treatments getting overall better, what is the recurrence rate of someone who has it? Is it like pretty curable for the most part?
Yes, so it's extremely curable as long as you follow the pathway. Yeah, so it's like if Deion Sanders decided he had it removed, he decided to do that because he wanted to be cured.
Right.
And now, less than a year later, he is cured from bladder cancer.
What about ex-Steeler Terry Bradshaw?
Yeah. Oh, yeah. It was interesting, his story. So he had two cancers at the same time. So he had melanoma and bladder cancer diagnosed at the same time. So, and often you'll see that. So if one person develops one type of a cancer, you're at a little bit of a higher risk of developing another one. So he had his bladder cancer was also like John Daly's, where it was just on the surface. He had it removed, and he didn't have any problems afterwards. He's still in the surveillance, like a remission protocol.
I have a question about that theory, and it may not be a fair or answerable question. Do you think that the reason for that possibility of having two cancers, either in succession or at the same time, is more a byproduct of the fact that you got cancer in the first place means that your sort of self-check system at finding these cells that are going awry and getting rid of them isn't quite up to snuff, therefore you're higher at risk? Or is it a byproduct of, well, you had cancer, you needed some pretty heavy-duty chemicals to try to get rid of the cancer. Every now and again, the result is different kind of cancer.
Yeah, so I think that's a very good question from an orthopedic surgeon.
Sorry, man.
Actually.
Yeah. I did go to med school before before my crayons and coloring books.
So you're bringing up a couple of very good points. So I think we have to understand that there are two factors to cancer. So there's environmental factors. So the things that we eat, we smoke, whatever, alcohol, all the different things we put in our body. So those are considered environmental factors. The water we drank, where did we grow up, that kind of stuff, right? The fertilizers around us, all that kind of stuff. And then there's the genetics of cancer, right? So I think both play a very huge role in developing, especially when you develop more than one cancer. So that can't happen to just one. Like
for some
one
reason,
factor.
P57 is popping up in my brain, but I don't.
Yeah, that's one of the markers. Yeah, so that's exactly what you're talking about. And now with all the genetic testing that we have, we're able to characterize if a lot of these things are from your body's own checkpoint system.
Right.
Yeah, so this is why you got to go to the doctor, because we are able to find out, and then we can tell you what your risk of developing a second cancer is.
Yeah.
So we have blood tests to do that.
It's pretty amazing, right? Like, exactly. The details and what we're able to figure out.
A lot of cool details, yeah. So Terry Bradshaw, that's another guy, and all these guys, they went online and they gave their statements, but nothing was more impactful than Deion Sanders. I mean, something clicked in him where he said, I'm going to take this diagnosis and this cancer journey, and I'm going to run with it. So
which is what he does, right?
And then this is prime,
that's why he's prime time,
right?
100%.
So Coach Prime.
Yeah.
So he said, I'm going to use every avenue and outlet that's possible to get this message out. And then he wove God into it too. Right. So every time he talks about something, he's talking about God. He's talking about kids rising up to the challenge. He's not even talking about cancer anymore, basically. Right. He's talking about any challenge in life.
Right.
He's saying you got to just face it. You got to have faith, and then you got to trust the people around you, the experts. And then he said, you just got to go with it.
Right.
And you will be the man.
Right.
And like, so now he's coaching. He went back to coaching.
Right.
And he is more fierce than he was before.
Right.
Yeah.
Amazing. He's an amazing guy, right?
Yeah. Of course.
And I love what he did to raise awareness on bladder cancer, because nobody really thought about it. Nobody really.
Right.
He was an easy guy to hate in his heyday if you weren't rooting for him, right? You know what I mean?
Right.
But now he's an easy guy to admire as well.
Yeah. I mean, he took the moment and he ran with it.
Right.
You know?
Yeah.
Yeah, and I think it's just a testament to his character too, as in his role as a coach, right? Because he's like coaching so many young men. He's trying to utilize this to take care of themselves too. And again, almost similar conversation to what we had a couple months ago about Alex Singleton, right? Like he was diagnosed with testicular cancer.
That one's crazy.
Off a random drug test where he tested positive when he was apparently not taking anything, and and then he used his platform as well to not just like kind of dismiss himself. He kind of went public about it for the same idea, to promote the health of that, to go see a doctor, to go get these screenings and other things, to make sure you're aware of what's going on with your body so you can catch it early. Right, and I think that's kind of like the big take-home message with all of these different stories we've talked about so far, of just like Deion Sanders, Alex Singleton use their profile and their platform to get the message across, so these people can, or everyone can kind of be more informed.
Yeah.
I mean, the coaches are just as important, if not more important, than the players, right? We talk about the players all the time. We talk about their stats. We talk about their life, their personal life. But what about the coaches, the ones behind the scenes who are inspiring these players, right?
Yeah.
Like Coach Prime.
100%.
Yeah. And this is about him. This episode's about him.
Right.
Yeah.
And all the coaches out there who are doing great things for the players.
All right. So then, speaking of which, we went through the scenario where somebody has there were some of the vascular issues and some of the clotting issues and whatnot, and you start putting the pieces together. What would be some of the other symptoms, red flags, signs that if someone says, and I keep kind of relating it back to like sports medicine and that, trying to do it within that realm. So it happens all the time, right? A coach has a question or two and asks the trainer, hey, what do you think about this? What do you think about that? What should be all of a sudden, like the red flag goes up, hey, we got to really take a look at this.
Yeah, so anytime you have blood in your urine, right?
Yeah.
So if you have any blood in the urine, whether it's on a urine test, which you'd be getting every year, or if you actually see it.
Yeah.
So that's the number one sign of bladder cancer, okay? Now, every time you have blood,
when you say urine test, like just a urine dipstick,
regular, So when you go to the doctor for a physical exam, so this is something that everybody should be having on a yearly basis. You're supposed to do blood work, have a physical exam, and give a urine sample. Yeah. Right. And the urine sample is just checking for a couple of different things, looking for blood in the urine and looking for bacteria.
Yeah.
Okay. And very simple. They usually dip it. It's done right in the office. If you have any blood in the urine, then there's simple tests that we do afterwards, usually an ultrasound or a CAT scan, and very simple to see, get eyes inside of your body and see if anything's wrong.
Sure. Yeah. Any other signs where they have pain, UTI,
like
more
a
frequent
urinary.
peeing, anything like that, like those sorts of things?
Yeah, so then continue on that list of symptoms. So you'd have, so if there's burning when you urinate, if you have pain when you urinate, if there's pain in the pelvic area, weakness in that area, all that stuff is related. So
does it ever go in the other direction, inability to void, like it's just blocking?
if you can't urinate, then that's a big problem.
That's worrisome.
Yeah, that's a big problem. Yeah.
Yeah, and I think, like with Dr. Frey, what Dr. Frey was saying of like in the world of sports medicine, right? Like you have coaches of various ages. They love coming to the training room and say, hey, look, I got this MRI the other day. You want to take a look at it or whatever the case is? And it's like, oh, great. Like, I definitely want to hear about everyone in this department's medical information because that's just kind of how, like, what attracts into our office, if you will.
Just what happens.
Just what happens, right?
Way it is.
But it's, it's interesting in that, like, how this can all get tied into because I think even, like, when I was looking some stuff up about John Daly specifically, he was seeing a doctor regularly for kidney stones and back pain.
Oh, yeah.
And then that kind of tied into this whole, his diagnosis a little bit as well. And it's, again, one of those things, like, granted, like you said, in the world of high school athletics, college athletics, I doubt many athletic trainers out there are going to be seeing this regularly.
It's going to be few and far between. Right?
But you may have an older coach who comes in. He's like, I've been dealing with these kidney stones and back pain and all these other things. He's like, when's the last time you seen your doctor? I don't do that. Just a kind of old school mentality.
Puts out a cigarette in the ashtray and
and go get other kids to go get on the line and start doing sprints, right? But no, it's just something that to promote, general public health, I think is also important to like get your routine stuff is really important in this
that
case.
Awareness.
Yeah. To go down our list of other iconic people, if you will, we'll go dial it back a little bit. We mentioned Terry Bradshaw with John Daly. And then back in the day for the Portland icon, Maurice Lucas, back in the NBA, he played back in the 70s. He was a 1977 NBA champion. He unfortunately died from bladder cancer in about 2010, I believe it was. So do you know much about his case specifically?
So his was left undiagnosed, unfortunately, and it spread outside of the bladder. And the treatment options around that time period were limited.
Right.
Yeah, so things have definitely changed since then. Mm-hmm. He was a little bit older, but unfortunately he did pass away from the complications of it.
Yeah, I think when I was looking, I think on his, they were saying they had tested and it looked like it was there for like almost a decade or so,
had it for a while.
For a while. And again, I think with early detection, it's relatively pretty curable, like we mentioned.
Yeah,
right?
yeah. So like John Daly, you mentioned, he had numerous scans. He was getting checked out for kidney stones. And then all of a sudden when he started having blood in the urine, they said, let's dive a little bit deeper.
Right.
It can't be just kidney stones. And it turned out to be something a little bit more.
Kidney stones don't cause blood in the urine?
They do.
Yeah,
they do.
That's what I was going to say.
Yeah, they do. So that's one of the mimickers, right? The great mimicker. So... but I find bladder cancer in young patients too. To your point,
about how old typically when you say?
I have patients in their 30s.
Yeah.
It's not as often, right? The typical age group is between 50 to 75, and more common in males.
Yeah.
But women also get bladder cancer as well.
That makes a lot of sense.
Yeah.
Right.
I mean, nowadays there's so many more cancers that we identify earlier age. Like we see a lot about colon cancer, right?
Right.
We see a lot of celebrities talking about colon cancer.
So a lot of screening,
and
huge push.
And they're younger.
Yeah.
So things are changing. A lot of those are those environmental things that we're talking about, right?
So in addition to the screening, there's probably just a higher incidence also, unfortunately.
Of course,
right?
Right. When you're looking for it, you'll find it a little bit more often.
And in addition to that, there may be a higher incidence. We're not just finding it more. It may also be higher incidence.
Right.
So,
Yeah. So in the cases of younger patients, is there anything that you've noticed in your practice, completely anecdotal, we don't have to go like research based.
Yeah.
Is there anything that you've noticed, like kind of like a correlation of like
trend.
lifestyle, like a trend, if you will?
That's a very good question. So that's a lot of times it's people who have other cancers in their family. like breast cancer or colon cancer. So, and their parents have those cancers. So that's that genetic component that kind of plays into it. So anybody who's had family members with cancer, they should be getting screened earlier and sooner. Yeah, and they should watch out more for the symptoms.
Right.
You know?
And I think people realize, right, if you have a history of breast cancer in your family, you know, same colon cancer, whatnot, melanoma for sure, right? Like, well, I don't think it ever once has entered my mind that, like, hey, also watch out because bladder cancer could be an issue for you as well. You know, even if the cancer of your family member was not bladder cancer, right? That's actually very surprising.
Right? Yeah. There's a link between all cancers. Yeah. So that's that change you were talking about in there.
For sure.
Body.
Yeah.
Right. And it's like good to know. I mean, that's why it's on your medical history sheet, right? If they ask all your family members all these different things, but it's also good to know that, one, and two, to also act upon it, and not like if you know your family has cancers in the genetic line of different things, take yourself to the doctor to make sure you're doing these things regularly.
Be more diligent.
Right. And this is the big take-home message of this episode of like general health for yourself, and screening and just overall public health, I think, is really important.
Well, anytime you play sports, you're supposed to get a sports med physical, right?
Right.
So that's not just to check your joints or your muscles. That's not just to make sure that you have the physical ability. It's to make sure that you have the metabolic ability too, right? Which means there's no blood in your urine and your blood tests are normal. And there are so many other parts to the sports medicine physical that we don't always think about because, I mean, I'll be honest with you. When young guys come to the office, they're fearless. They feel like they're young, they're healthy, they're energetic,
right,
and they're ready to go. Like, you know what I mean? Like they're like, this could
Invincible.
never happen to me. Yeah, they're invincible. This could never happen to me, right? But
it's part of the beauty of youth.
Yeah, it is the beauty of youth. But unfortunately, the youth can get cancer too.
Yeah, right.
You know?
Unfortunately, it's definitely.
But very treatable when found early.
Yeah.
So this episode shouldn't be a downer. It should be more about awareness.
So if we haven't brought enough people down in the Philly area just yet, let's start talking about this last
a little bit of sports, huh?
No.
Rough time in the world of Philly sports, right? We had to bring it up, right? You can't. It's not a sports medicine show if we don't mention Joel Embiid and his downfalls of some sort.
Right.
But yeah, rough week for the Philly sports fan.
He played well against Boston. Yeah.
He did. He kind of played a little bit here and there against the Knicks, and it was a great round one for Philly across the board with the Flyers and Sixers, and round two was ugly.
Right.
Real, we went 0 for 8. It's not good.
Right. Yeah. No, that was rough. And with the Flyers, it looked like oh my gosh, is Pittsburgh gonna pull off what it looks like the Sixers may be pulling off, and the Flyers were able to squash that before it came to fruition. Honestly, thought they were outplayed in that third period and in the overtime, but they got the goal, right?
They did.
That's what does it. That's all it takes. And on the other side, for the Sixers, I'm torn there, right? I do like the Sixers, but I grew up a Knickerbocker fan, and this Knickerbocker team is also like the Villanova Knickerbockers. It's kind of crazy.
It is crazy,
which, ironically, I don't like having gone to Georgetown, but here I am now rooting for the Villanova Knickerbockers.
Well, I went to Villanova.
Did you?
Yeah, of course. But I'm still a Sixers
fan. So thank you for coming on. It's been great having you.
I don't understand, because they did so well with the Celtics, and then what happened? And Embiid played.
It's matchups.
But he's injured.
I think it's got to be, right?
24 points in Game 4, right? And then Maxi's injured, but I don't know. Did they just lose their gas? Did they run out of gas?
It's almost crazy. I watched Game 2 when Embiid was out, and they had a really good chance to win that.
Actually, they did. They played very well.
They had a great.
That was the closest game.
Right.
Right.
And then I think Game 4, up until the fourth quarter, maybe, or no, I didn't even watch Game 4. Game 3, it was close. And they couldn't, finish. It was just tough to watch. I mean, granted, to switch gears and we're talking about the Flyers a little bit, is that at least they pushed the envelope. They pushed overtime a bunch of times.
Yeah.
And it's also
Carolina's
crazy.
A very good
they
team.
played Carolina, 7 or 8 times this year, and they went in overtime 6 of those times.
That's crazy.
That's a wild thing. You're competing, unfortunately, you couldn't just finish the job.
Yeah.
And I think the credit to them is that they're very young, which is a good thing for the future, right? Is what you kind of like hopeful. Yeah. And I think the big thing of this playoff push is that at some point in time they had a 3% chance of making playoffs, and they made a big push. They made it. They may have wiped out.
Yeah, keep rubbing it in.
They played well against the Penguins, and they could have sent off the big three in Pittsburgh for the last time. You never know. Like,
I feel like that probably was right. Like that was a good push. Like they're getting old, man.
Yeah. And it's also crazy. Like the stats that they put up during the Penguins and Flyers series of Malkin, Crosby, and Letang, and all the times they've played together.
Insane.
All the games, like just amazing how like that big three has played so much together, and we were able to witness it.
And Jordan Staal's on Carolina, who was part of those Penguin teams that were really yeah. I find it shocking. We talked a little bit about this beforehand that typically a good NBA team is made up of college all-stars, right?
Yeah.
It's rare for a good NBA team to be primarily one college team. Yeah. Like that's it's nuts. It's like I still can't believe that strategy has worked.
Yeah.
But they are very good. They are.
100%.
I mean, their 3-point rate is amazing.
Yeah.
Right in the playoffs.
In the playoffs, they're just on fire right now.
They're on fire.
Yeah.
It's
and
like
whoever they play, I don't know if they're going to play Cleveland or Detroit, but I don't know if that's going to start to shut it down.
Split.
Like if you have a really good
2-2.
defense.
It's split. Yeah. So we'll see. I don't know. They're both playing really well too.
But if they continue to play like this, they are forced. They should be in the finals, and then we see what happens there. A couple good teams in the West that could be pretty formidable. But
I think the Spurs are playing tonight, right?
Right.
Yeah, another good matchup or another good series. So to kind of go a little off topic and to what we're talking about in regards to the Flyers or whatnot. Recently, the Flyers let out a statement about Owen Tippett, who didn't play in the second round here.
Right.
It seems like, and I just kind of looked it up because the initial statement was mentioned that he was suffering from internal bleeding. He couldn't finish and couldn't get back into a safe state.
Yeah.
And then I just kind of like Googled it to see what the update was, and it sounds like he had a sports hernia, and then he was having also internal bleeding with that as well.
Wow.
Which is a wild combination of things just from reading it. So I don't know if you wanted to.
Oh, that's interesting.
What your reaction to that information is?
My gut reaction is I don't really see how those two things were connected.
Yeah.
I mean, I guess maybe they are, but it like I mean, you think typically like standard hernia. When people say I had a hernia, usually they're talking inguinal hernia.
Right.
But you can have hernias like kind of all over the place, and lots of times you have basically your intestine. Well, that part's not going to work for the bladder for that guy now. But your intestine kind of bellows out or kind of pooches out, and then sometimes it can be kind of get stuck in there, and then the blood supply going to that area isn't getting there, and then it can necrose, and then that's a real problem if and when that were to happen, kind of a surgical emergency. A sports hernia is different than that, right? Like it's more of a like a cartilage or thick kind of fascial / muscle attachment to in the pelvis, kind of in the front of the pelvis, sort of peeling up. You don't normally actually get any tissue herniating through that.
Right.
That's what I don't.
I don't quite
I don't think they
follow.
were 100% related. Now I'm just trying to find more stuff on the fly here, but that's at least what he was dealing with.
Right.
So he said that the injury was separate from the internal bleeding issues. They weren't connected, but they were happening at the same time.
Maybe he was taking a lot of Advil because he was trying to treat an NSAID, whatever, NSAID du jour, and maybe that's what led to some internal bleeding. Maybe he took a big hit. I don't know. Yeah, that would be. And if the guy's having internal bleeding, I guess I can see even a hockey player not playing when that's going on.
Yeah,
right?
even though hockey players are tough as nails, right? Like, whew.
Yeah.
They're a different breed. So I think
it's always tough to figure out what's going on in hockey because they are super protective, right?
About their information.
The information.
That's what I think. Is it's interesting when you get a little bit of information from them. It's like, oh man, like that came out, like the internal bleeding issue, and then it's funny too, right? Because you look up the information, it says sports hernia and internal bleeding. It's like the general public might put those together, like we just almost did right here, like,
right?
And it's just a matter you read a little bit more and say, oh, that's a little separate.
Yeah. And that's exactly, and that's why we're here to say like that would be a little bit odd,
right?
So I don't quite see how those two things fit together.
And that's what I kind of thought too, but I'm glad I kept reading a little bit, and it's a different article. I don't know. I didn't even bother to state the source.
And I will say there's also sometimes strange things happen. Like we can't explain it, can't really figure it out or justify it, but just weird stuff happens. It's biology, and I say this, and I don't think patients love it, but it's a soft science. Like it's not physics, man. Like with physics, you can do the calculation and it'll be exactly the same every way. Yeah. Biology, sometimes it goes this way, sometimes it goes that way. Like it's a soft science. Right?
And you never know when these subtle different things could lead to something like we mentioned before of like the Alex Singleton case, completely out of left field with a random drug test,
right?
And something else happens. It's like you caught something way early,
right?
Same thing with all Deion Sanders, routine test for something else, and something else popped up, and it's like, well, now we're having a separate issue because of these screenings.
Yeah.
Do you think that would have changed the playoffs if he played? Yeah. I don't know. I just think about it.
Oh yeah, I think
there's a lot of focus on him right now.
Yeah, so. I think it would have made a slight difference, sure, but overall, I mean, I think just Carolina outplayed us at the end of the day, and they're a really good team.
They're good.
Good. And Flyers are young.
They're young.
It's not like it went to overtime in Game 7.
Yeah.
The games were close, but it was a sweep.
Yeah. At the end of the day, you still couldn't beat them.
Yeah.
I think we played them, like I said, we only beat them once or twice all year. So.
Yeah, you said earlier, like them or Vegas. I feel like they're.
Yeah, that's what's coming.
Not to discount any other team that's out there that has a shot there.
But just based off how teams are playing currently, right? Like you just kind of make your pick, which makes sense.
Yeah, for sure.
They're on fire. Vegas is on fire.
So to go down our list a little bit too of some more notable names, if you will. The great Frank Sinatra also dealt with some in the world of music, if you will.
Yeah, less sports affiliated.
Yeah, a little less sports affiliated, but New York related, if you will, a little well tie in there.
Well
He also had bladder cancer, and Phil Lesh from the Grateful Dead. Also was dealing with this as well. So again, I think like we've talked about a little bit pre-show of like it's more prevalent than you think. It's definitely, and I think it's also not as. It's not thought about like you mentioned earlier, like Dr. Frey, like it's not, you don't think about it as much or like a go-to diagnosis or a thought or in your wheelhouse.
Right.
Yeah, I mean, like for example, in the Super Bowl, they had an ad about prostate cancer, right? There was a big ad, right, with George Kittle was in it.
Right.
Yeah. About your
it was pretty funny, tight ends.
Yeah. And that's a big thing, which maybe we'll talk about in September.
Prostate
Cancer awareness.
There we go.
There we go.
But the reason for that is there's a lot more money in prostate cancer, right? In terms of funding, cancer research, whereas bladder is just starting now.
Right.
Yeah.
And I think that's why Deion Sanders did that.
Yeah.
Because now bladder's coming to the forefront.
Start the conversation.
It's becoming more common.
Yeah.
So just start that conversation, which we've had for prostate cancer, which is more common, obviously, 1 in 6 men.
Right.
But bladder's in there too now. It's coming up, man. So, and to have a commercial during the Super Bowl is a pretty big deal.
Yeah.
Right.
Yeah.
And so.
And just perfect, right? A little bit lighthearted, but like a good message. Like,
relax your tight end.
Yeah.
Relax.
Hey, and I mean, and again, it's it's a good marketing campaign, if you will, to get the message across in a good way. Similar to our conversation tonight, right? We want to get this information out in a positive light to, again, take a step out of our normal of the sports medicine world a little bit and getting to the public health sector, if you will, of like getting these things taken care of. So is there anything else in the, we've mentioned annual screenings, annual physicals. Is there anything else that you can do for, prevention or anything along those lines in the world of awareness for this?
Yeah, so prevention for any kind of cancer is a diet filled with a lot of vegetables, antioxidants, so fruits, staying hydrated, so water. You can drink other stuff too, but water is pretty important.
Probably not Diet Coke.
Yeah, and lay off the diet. I mean, don't make Diet Coke the only thing.
Stay right. Right.
So anything in moderation, right? So but a diet that's filled with a lot of the good nutrients, and stuff like that. Don't eat fast food every day.
Right.
That kind of stuff. And because fast food has a lot of sodium, has a lot of GMOs, processed meats, and we know a lot of those can cause cancer. So,
Yeah, for us it tends to be if you're on a trip, right? Like where you're driving here or driving there or whatnot. Like, all right, then
Yeah.
But in general, it's not a standard. It's not in the.
There are a
in the
lot
mix.
of fast food options that are healthier.
Yeah,
now,
yeah.
too,
I think
right?
times have changed for sure.
Yeah, so
Yeah.
times have changed. There are a lot more chains out there that are focusing more on health.
Yeah,
And so try to choose those rather than our traditional
100%.
ones. And that kind of clean, healthy lifestyle was what we want.
Right.
Right. So I think we touched on a little bit of everything tonight, if you will. I don't know if you have.
We have something in a couple months. We're not quite there yet. A little NATA action coming up.
Yeah. I mean, we're we're like 6 weeks away. Believe it or not.
Is it 6 weeks?
Yeah,
Wow.
I'll
All right,
give or
we're almost
take.
there. Yeah.
We're getting closer. So before we go ahead and close our tab, just a quick reminder to any of our listeners out there: we will be present in Philadelphia this year for the NATA conference. We will be recording there on the expo floor. Don't know exactly where. We'll give you more details as we get closer.
We'll find out.
Keep an eye on our Instagram specifically. We're going to have a sign up soon if you're interested in joining the show. We're going to do like 20, 30-minute episodes on the floor there and try to meet as many people in the world of athletic training and at the NATA conference that we can. So before we go ahead and close out the rest of our tab here, we just want to give a quick shout out to Neck of the Woods Brewing Company to give us these great, delicious beers, seltzers, and sours. Don't forget, Sourfest is this weekend, May 16th, here at Neck of the Woods from 12 to 8 p.m. And lastly, Timberreal Productions helping us get all this multimedia out to everyone on social media, YouTube, and wherever you're listening to this podcast. So thank you very much, and we'll see you next time.